Hi, I'm Dr. Nicole Fanning. I'm an OB hospitalist working out of a hospital in Virginia. Today I'll discuss a case of a first-time mom who was sent in from the office. She had gone to the office to see her doctor for lack of movement out of her baby that day, and actually for the past 24 hours. In the office, her doctor noticed that on a test called a biophysical profile, which the baby should score an 8 out of 8 in a perfect scenario, this baby only scored a 4 out of 8 and actually was not moving its extremities as much nor doing the practice breathing that we should see out of a baby in the womb. Additionally, they did another ultrasound and found that the baby had new loops of bowel that had excessive dilation in it, so they thought the patient should be sent to the hospital for prolonged monitoring. She was in her 36 week of gestation, so not quite ready for delivery if possible. So upon receiving her at the hospital, she was put on the fetal monitoring strip and was noted to not have a perfect strip, but also not have a bad fetal monitoring strip. So she was administered steroids to help the lungs mature and was signed out to the hospitalist for monitoring overnight. At the start of my shift, the baby started to have what we call fetal decelerations, or where the heart rate would go down. At first, they were short-lived and easy and okay to watch on the monitor, but progressively the decelerations got deeper and longer. So I decided, since the baby didn't have a perfect score on the monitoring earlier in the clinic, and since the ultrasound found a new finding of dilated loops of bowel, that it was probably time to deliver, given their new findings of decelerations on the fetal heart rate tracing. So I took her to the operating room. We performed a primary cesarean delivery, given the baby would not tolerate the stresses of labor. And during the delivery, everything turned out well. But at first, the APGAR score was a score of 4. Ideally, the best score is a 10. So this baby was clearly in some distress in the uterus. After a quick once-over by the NICU team, the baby recovered fully and was able to stay with mom and dad in the operating room for the duration of her surgery. So I think this just goes to show that without a hospitalist on duty in the hospital overnight while the private physicians are at home, it could have been another 30, 45 minutes difference until this patient's doctor could have made it to the hospital. And that could have been all of the difference in the score that baby received upon delivery. And perhaps that baby could have had to have gone to the NICU or worse, required further resuscitation with breathing efforts or the like. So I think this just goes to show the beauty of having a hospitalist on call in your hospital 24/7, that there's always someone there to respond to emergencies and keep a close eye on the babies and the moms while the private providers are at home resting and recuperating for the next day.